In this video, we're going to do an overview of albuterol. Your albuterol is going to be a nebulized medication that's packaged in what we call a little bullet. This is packaged 25 milligrams in 5 mLs. So albuterol is a beta-2 agonist, which induces the bronchial smooth muscle relaxation when it becomes inhaled. It is primarily a beta-2 agonist, but it also has a minimal effect on beta-1 receptors, which is where we get our slight increase in heart rate. It's also a sympathomimetic bronchodilator with sympathomimetic, meaning that it mimics the sympathetic nervous response system. When those beta-2 receptors are stimulated, it helps with bronchodilation by relaxing the smooth muscle in the bronchioles. It also helps inhibit the hypersensitivity mediator release, such as the mast cells, which produce the histamine, and the histamine contributes to bronchoconstriction, so that's why these are great for our asthma and anaphylaxis patients. So it also helps stimulate the sodium-potassium pump, which causes the intracellular shift of potassium. So it lasts about 2 hours, and it can lower your serum potassium levels from 0.3 to 0.6 milliequivalents per liter. Our indications, like I've mentioned a little bit before, for your asthma, it's also great for your COPD, emphysema, your chronic bronchitis, any patient that would exhibit some sort of bronchoconstriction, or any kind of bronchospasms, such as our anaphylaxis patients. It's also great for crush syndrome. Remember, crush syndrome doesn't last until they've been trapped for greater than 4 hours, but it's that shift for the potassium where the albuterol does help some with that. Since it does stimulate the beta-1 receptors just a little bit, that's where we get like our tachycardias. It can cause the tremors, anxiety, sometimes dysrhythmias, palpitations. Known contraindications is your hypersensitivity to albuterol. And then a relative contraindication is our tachydysrhythmias. So if we have a patient that is experiencing difficulty breathing, they are going to be just a little tachycardic because they're anxious and their body's trying to compensate. But we don't want to withhold albuterol because that is going to eventually help with that situation. For adults, it is 2.5 to 5 milligrams per nebulizer. If you have a pediatric patient, if they are greater than 2 years of age or weigh more than 20 kilograms, they can get the adult dose of 2.5 milligrams in that nebulizer. If they are less than 2 years of age or weigh less than 20 kilograms, we're going to do half of that, so 1.25 milligrams. These are always going to be administered in a nebulizer. Just a quick review, you got your chamber, so remember you're going to open that up and you're going to squeeze all your albuterol in that chamber. Screw it back on. We've got our T-piece, our mouthpiece, and then our corrugated piece. And then you always want to hook this up to oxygen and run it at 6 to 8 liters per minute. Just some quick notes for albuterol. Make sure you're using caution in patients that are taking TCAs, so your tricyclic antidepressants, or your MAOIs, your monoamine oxidase inhibitors, because it has been found that the medications that they take, those TCAs and those MAOIs, it can increase the effect of the albuterol. So don't withhold it, just anticipate that they're going to have a stronger effect from that albuterol. Right now, there are no studies on breastfeeding mothers or pregnant patients as to if albuterol has any harmful effects to the breastfeeding baby or to the fetus.